told you guys that we kind of have these valves between the hearts. So between the right atrium and right ventricle, right before you have contraction of the heart, right before systole, this valve is going to close because you don't want the blood to flow back up in the right atrium, right? So that when that valve closes, that's the first lub that you hear. So when you hear the lub of lub dub, that's going to be these valves. Now these valves have names. I can give you guys the names. Has anybody heard valve names before? If they want to throw one out, if they know it? Okay. So the valve here is called the tricuspid valve. I know. They're very fun names. So this is the tricuspid valve. Now there's a reason why it's called the tricuspid valve. Three. We'll get to that second. And then the one over here is called the bicuspid valve. So there's going to be a reason, and I'll tell you guys in a little bit why one's called the tri and one's called the bicuspid valve. Interesting thing all about the bicuspid valve, there's another name for it. It's also called the mitral valve, because we like to have several names for things in medicine, which you guys will find. Now, so when these valves close, that's going to be the first sound of systole. So that's your lub. But there's a second heart sound, right? You hear the lub dub, right? So at the end of systole, we also have valves between the pulmonary artery in the right ventricle and the aorta in the left ventricle. And the reason why we have valves here is when you think about it, right? The right ventricle is going to contract, and then it's going to go ahead and relax, right? But when you're pumping all that blood, and then you go ahead and relax, the blood's going to come straight back down, right? Because there's nothing pushing it anymore, right? So to kind of stop that blood from backflowing, we have valves between the pulmonary artery in the right ventricle and then the aorta in the left ventricle. These names are a little easier to remember. The one between the pulmonary artery and the right ventricle is called the pulmonic valve. Pulmonic valve, yep, because it's between the pulmonary artery. Okay. And then the valve between the aorta and the left ventricle is called the aortic valve. So these ones are a little easier to remember. And I'm going to show you guys in a little bit, these valves are designed a little differently than the valves up here. It's kind of cool how they look. Okay. All right. Has everything I've made so far made sense? Okay. Any questions so far? Okay. All right, so at this point, we've kind of shown how we get blood from the body, comes into the right atrium, goes to the right ventricle. Right ventricle is going to go to the lungs, pick up some oxygen, going to bring it back from the lungs into the left atrium, to the left ventricle, pump it out to the body via aorta, right? Now, if everything in our body needs oxygen, do you guys think the heart needs oxygen? Okay. No? No? It does. So how do you guys think that the heart might get oxygen? Okay, so it's going to pick it up from the lung. Where do you guys think it might pick up the oxygen? Through the what? Okay, so it does get it from the blood. So from arteries, yep, and veins. So it's going to get it from arteries. There's a special couple of arteries that bring the blood right to the heart. And they come off right when the left ventricle pumps the blood to the aorta. There's these little arteries called coronary arteries. Nice, coronary arteries. These guys are super important. You're going to learn about them later in the week as well. These guys are one of the reasons why when you heard of somebody having a heart attack, have you guys heard of somebody having a heart attack? Yeah. Zach, go ahead.
Are they in the wrist?
The what?
In the wrist.
The coronary arteries? They aren't in the rib. They're actually kind of right around the heart. I'll show you guys kind of where they are. You have a radial artery. Is that the one you're thinking about? Okay. But yeah, we do have kind of special arteries in wrist too. They come right off the aorta, and they're going to go straight to the heart. And the reason why these guys are so important is if you block one of these guys, so what happens if you don't get oxygen? You die, right? So if we block the coronary arteries to the heart, that part of the heart will die. So that's not good, right? Okay, so when you hear somebody having a heart attack, that means their coronary arteries got blocked up. And that heart couldn't get oxygen, that piece of the heart couldn't get oxygen, so that piece of the heart died.
So, you said the coronary artery goes into the left ventricle, and if it's blocked, then the left ventricle dies, which means that the whole system dies, right?
That is
it goes in a little pattern.
That is correct. So the coronary arteries, it doesn't even go just to the left ventricle, it goes all over the heart. So you have coronary arteries, they split. So that's the lucky thing is your coronary arteries are going to split into your right side and your left side. And they'll split up. And so if one piece of the coronary artery dies, that piece of the heart, if it gets blocked, that piece of the heart can die. So that's not a good thing. But I just want you, go ahead.
Can't you have like a piece of the heart die without dying?
You can't, that's a great point. So the cool thing about the heart and about the body in general is you can kind of kill off pieces of the body, but maybe when you block an artery, you don't hurt too much of the heart. You can hurt a portion of the heart, but you don't hurt enough of it that it can still function. Did that make sense?
What part is it like the Widowmaker?
What part is the Widowmakers?
Yeah.
I mean, that is a great question. So, how did you hear about the Widowmaker?
I think I was watching TV.
Okay. Have you guys heard about the Widowmaker before?
No.
He watches too much television. So you guys have heard. Some of you guys have heard about it, and some of you guys haven't. So there's an artery in the heart called the Widowmaker. The reason why it's called the Widowmaker, and you actually guessed this correctly, is it's the artery that runs over the left ventricle. As you guys can tell, the left ventricle is kind of super important because it's going to pump all the oxygenated blood out for the rest of our body. So the Widowmaker is the coronary artery that runs across kind of that left ventricle there. And when you block that artery, your left ventricle is going to have a portion of it die. You're not going to be able to pump blood as efficiently to the rest of your body. They call it the Widowmaker because it's kind of goes without saying. Your chances of survival. The cool thing about that is you guys are going to learn more about that kind of coming along the week. But that's a great question. All right. So I think we kind of went through. So kind of what I said about systole and the heart sounds and diastole. Does those things make sense to you guys? Okay. Do the coronary arteries make sense? Yes. Okay. Do you guys want to see how this looks like for real in the body now?
Yes.
All right. So I've got a couple things. I've got a nice model here, and I've also got kind of some pictures to kind of show you guys how it looks like in the body. And I'm going to turn on, and everybody has this down, everybody's notes are okay? Okay. So it's going to take a little bit for the screen to warm up, but while kind of the notes are warming up, what I'll go ahead and do is kind of show you guys how the model looks like first. How's that sound? Okay. And what I'll do is I'll kind of come around and show you guys. But so the big thing about the heart is, I showed it to you guys in a box on the board, right? But of course, like the heart, how it looks here, this isn't a box, right? No. So kind of when we talk about the heart, kind of one of the big things is kind of knowing to understand how the heart looks like and where it is in kind of relationship to other structures of the body. So that's a big part of anatomy in itself, is knowing where things are located and what are they next to, right? Okay. So I'll kind of show you guys my first slide here. I've got kind of a, oops. So I've got a picture of, this is kind of the heart sitting, these are the legs, right? There we go. That good? Okay. So this is the heart where it sits in the body. There's a bone right above it, right? That bone's right here, right? Does anybody know what that bone's called? Sternum. Awesome. All right, so the heart's going to sit right kind of behind the sternum. Okay? And kind of when also you think of the heart, now I've removed the sternum, right? So the sternum's gone. So we've taken away our sternum. The heart's going to be sitting between the lungs, right? So we've got a kind of heart sitting right between the lungs. And anybody ever seen kind of lungs before? Your lungs are huge. The lungs are absolutely huge. And your lungs take up, like from good parts, so your lungs start here, and they go all the way down to here. So your lungs are really big. So they're going to be taking up kind of most of your chest as your lungs, right? In between the lungs, your heart's going to be sitting right in between there, which is kind of cool. And kind of behind the heart is, does anybody kind of know when we breathe in, we breathe into a structure called the trachea? Anybody heard about the trachea? Okay, good. So kind of behind the heart is the trachea, right? The trachea sits right behind the heart, so that we have all that oxygen flowing through right behind the heart. So they're all really close together. And even behind the trachea, when we swallow, what's the kind of structure that we swallow with? Esophagus, right. So right behind the trachea is the esophagus. Can't see it there. Up here is the trachea. So you can see the trachea there. I'm going to turn the heart around. See this pink thing here? That's the esophagus. So we have the trachea is this kind of gray thing. Pink thing behind it is the esophagus.
So where the food goes?
So where the food goes down the esophagus. So we have the food goes down our esophagus, air goes down the trachea. Make sense?
Can that close?
Can the esophagus close? The esophagus does contract. It's kind of an interesting process. It kind of like contracts food all the way down. Okay, go ahead.
Like when you're drinking water and you be choking, is that because it didn't go down the esophagus, it went down your like your trachea or something?
Exactly. Perfect. Okay. All right. So kind of you guys kind of understand what's going, kind of those structures that are kind of around the heart here. So we've got the lungs on the side here. Behind the heart, we've got the trachea, which connects into our lungs. We've got the esophagus even behind that. We've got our sternum in front. We took the sternum off. Now, here's kind of how the heart sits. When we think of right and left, right? We think everything on the right side should be here, and everything on the left side should be here, right? The heart's kind of funky. Exactly. So it kind of twists. So the way a heart goes is this is our right side of the heart, and this is our left side of the heart. Is when we form, when we're kind of babies and we're developing, the heart kind of forms and it twists, right? So this is the heart. This is my right side of the heart, and this is my left side of the heart. So the way the heart's sitting here, my right side of the heart's kind of mostly on top here, and my left side of the heart's kind of in the back here. Does that make sense? It's kind of funky. You wouldn't really think it would do that, but it does. Okay? So I'm going to kind of show you guys how that kind of works. Now remember we were also talking about, you've kind of got these things that flow into the right atrium, right? What were the two things I told you that flew into? All right, awesome. So superior and inferior vena cava. All right. So I told you guys this is kind of my right side of the heart right here, right? So I'm going to open up our heart. I know. So here's my right atrium. Okay? What did you say? Okay, so here's our right atrium. The right atrium is kind of right on the top here on this front side of the heart, because our right side's on front. Flowing into the right atrium, I have this here, this thing up here. What do you think this guy is flowing right into from above? Awesome. Now there's another guy down here who's also flowing into the inferior. So that's going to be our inferior. So it's kind of cool that this right atrium from both sides has the superior vena cava and the inferior vena cava flowing into it. It also has something else flowing into it.